Juvenile arthritis is an inflammatory condition that can develop in children under the age of 16. It affects nearly 300,000 children in the U.S. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker explains why it's so important to catch this condition early.
When most people think of arthritis, they think of older people with the condition, but kids can get it too.
Similar to rheumatoid arthritis in adults, it's an inflammatory disease that affects mostly the joints.
Dr. Anthony Infante, a professor of pediatrics at UT Health San Antonio who sees patients within the university health system, says the cause is largely unknown, but there is a likely genetic component and environmental triggers.
Things like infections, maybe trauma, maybe environmental chemicals or other substances.
But how do you know if it's arthritis and not just typical wear and tear?
Some of the signs of juvenile arthritis could be redness around the joint, swelling in that same area, and it could also be warm to the touch.
Sometimes you'll get some transient swelling just from overuse. You'll put some ice on it, and the swelling and pain will go away. So that's not usually arthritis.
Juvenile arthritis is a chronic condition, meaning it can last for months, days, or in some children, if not treated, even a lifetime for those diagnosed.
The textbooks say that about half of kids will eventually not have joint symptoms as adults. That still leaves 50% of children that are going to have some degree of arthritis.
That's why catching it early is key.
So that not only are the symptoms of pain and swelling addressed, but the disease process is arrested so they don't have the long-term consequences.
Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just head to wearthegown.com.